everybody's here. Well, I'll record it just in case.
Well, ask if everybody is on the. Is everybody on their computer where you can see?
Yes.
Oh no, this is I just did phone. Let me go on.
Yeah, I'm on the computer.
I think Rodney said he was driving, so.
Okay. Yeah, so go ahead and record it. That way they can have the visual.
That's true.
Hold on.
All right, it's being recorded then. Well, Mike, since you're here, I didn't get a acceptance of my invite, so I wasn't sure you were going to be here. So I'm glad you're here.
Well,
I'll
that's because I was reliving Michael Jackson's Propofol Last Dream yesterday. So I had that epidural done, and I just all I wanted to do was to take a nap all day, and so I did take a nap part of the day, and so I'm behind on email. Sorry about that, but I'm alive today and here, and the back feels much better because of the epidural, like it did 6 years ago when we did it. So I'm happy to report that. Yeah.
Okay.
So I'll go ahead and fire this off and give about just one or two comments. This is a very nice case that broker Tapert Insurance Agency, or Charles Tapert, represented by Patricia Carlos, the account manager for the client, Post Alarm. Nice little client. They're an alarm company, which means also that the majority of their working staff are outside the building. So it represents those same challenges that we've had in any other client, where we have most of the employees located outside the building. So we have office staff that are fixed in place. We have arrangements that Andrew's going to talk about to take care of them in kind of the normal way, group meeting 101s, because they're kind of there. We can draw from that pool. And then how we're going to, she'll describe also how we're going to access the 94 folks that are outside, or I believe it's about 94. So I just, as usual, I want to thank all of you for being a part of the enrollment team on this case. You all do such wonderful work. That's what makes my phone ring from our brokers, because they remember the last case we did for them, which goes well, and that's what sustains our business model. So thank you for that, Andrea. I'm just going to give it over to you.
Oh, well, thank you. Patricia, did you want to share anything about the group at all?
Again, just wanted to say thank you so much for helping us out with this case. And I am new to this group as well. My colleague Tatiana was their former account manager. So I'm learning the group's dynamics along with you. So thank you so much to Mike and Andrea for being patient as we get information with regards to this open enrollment, and with regards to their benefit offerings. So with that, over to you, Andrea.
Hey, Andrea, before you jump in, just a housekeeping thing. I don't know what's going on with GoToMeeting in the last couple of weeks, but it seems like some calls have been dropped off. So if anybody loses your call, or you lose audio, you don't need, and if you're on your PC, you don't need to leave your PC for the visual. Just hang up the phone and redial back in. It's happened to me a couple of times. Maybe they've got some technology things going on. I don't know, but I just want to give you that housekeeping tip.
Oh, thank you. Yeah, because I just started to, I thought I was starting to lose the call for a second. I thought, wait a minute.
So did I. That's what made me think of it.
Oh, okay. Good to know. All righty. I'm just going to start real quick with the, as Patricia knows, I'm still waiting on some documents from Patricia. She still needs to send me the Kaiser application and the Kaiser plan summary and the AIG application and plan summaries. But we wanted to get the call done, and so hopefully I'll get those out to you today. But for the medical insurance, they have one Kaiser HMO that's an existing plan, and it will continue. So only the employees who are going to be making any kind of changes, if they're going to switch to the new carrier, Health Net, or if they're going to change coverage level, they're the only ones that have to fill out a Kaiser application. If they keep the same plan, they don't have to do that.
Okay, just so I can jump in there real quick.
Uh-huh.
Sorry about that. Just a point of reference. The group had put a soft freeze on the Kaiser, and they are now this year opening it up to all employees. So, just to let you know, if you have anybody saying, well, I've never been offered Kaiser before, just let them know that it's available, for this year. And the price point, the Health Net plan is going to be a better price point for them. So we don't anticipate a large migration of individuals going to Kaiser. But you may get some questions as to, well, why haven't I been given Kaiser opportunity before?
Okay, that's good to know. And you will see in Harmony under the existing benefits tab, you will be able to see everybody that has what health plan they have. It'll just be abbreviated, Kaiser, HMO, and their coverage level, or it'll say declined, or it'll say waived, or it'll say in their waiting period. Those that said that they're, yes.
I'm sorry, just a quick one. Patricia, I may have had a phone thing go in and out, but did we have kind of a talking point for that question? Why wasn't I offered this before? And I may have lost part of the phone there because it seemed to me it went quiet for a little bit.
The only talking point to your staff would be, if someone does ask you, well, why haven't I been Kaiser previously? Just let them know that it was a frozen plan, and that for 2016 it is available to all employees.
Okay. If it's okay with you, I'm going to add something to that. So everybody, I would add to that a little preface that every year the entire architecture of what's available in our business changes, and every employer has to reevaluate what plans they offer, and then pop that in there. And that this year, it was very obvious that we needed to make this available to everybody, and along with Patricia's comment. That always helps with that, explain every change, whether they had a weird policy in the past or something like that. So just if everybody can use that talking point, if you get that question, then we keep HR's doorway clear of inquirers and people going blah, 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 blah. Okay, thank you. Back to you, Andrea.
Okay, and then this year they are, the new plans are going to be through Health Net, and what's the carrier they're replacing again?
That would be Anthem Blue Cross. They're going from a select network and a traditional network, and now we're going to be offering the 3 plans through Health Net.
Yeah, they have the Health Net XL Care plan, which uses the XL Care network, the Health Net Smart Care HMO, which of course uses the Smart Care network, and then the Health Net Salud EMOS HMO, which uses the Salud EMOS network, and then they're offering a PPO. So there's going to be a lot of choice this year, and Dana got everything to everybody last week to start looking at. Is that correct for Patricia? Because I know that's on our conference call. That was what her goal was.
Right. So she did send out the benefits selection form, them all of the plan details. So I believe they just know the names and the premium associated with it.
Okay. And then we're going to get more in depth in the plans when we get down to that section of the enrollment guide. And dental insurance is offered on a voluntary basis through Premier Access, and they have a DHMO and a DPPO, and these are existing plans, and you will see under existing benefits who has these plans, so that if they want to keep the same, all you have to do is select the same. They have vision, and okay, Emeritus. Did I say that right this time?
You got it,
Emeritus. All right, Emeritus VSP Eye Care Plan, and that is also an existing plan, and you'll see under existing benefits who has the plan who declined it, who waived it because they have other coverage, and who's in the waiting period. Oh, I forgot. All the ones that were listed in the census in their waiting period, are they eligible now so that they can enroll, Patricia?
I believe so, but we'll clarify in the morning with Dana just to make absolutely sure.
Okay. And then they are offering new this year, correct, that AIG $10,000 basic life and AD&D plan for the employees. And then there's a few executives that are going to get 1 time their annual salary. And that's paid for by the employer. And then those same executives will also get a group, I've labeled it STD in the guidance, my mistake, is LTD, a long-term disability plan that they'll have for the executives. And that's also paid for by the employer, correct, for the executives?
Yes, it is. And to jump back up, the group term life is life and AD&D. The voluntary is only life. We did not opt for an AD&D on the voluntary.
Okay. I'll label that in the guide as well.
And then just a reminder, too, on the employer-paid life and LTD, we still need to sit down. I would imagine that we still need to sit down and collect beneficiary information if somebody says, well, I'm already enrolled in that, and, et cetera. So we have to have the beneficiary information.
Right. It's a new line of coverage for all 3 of them. So there are no beneficiaries on file.
Yeah, these are new plans, so everybody has to enroll in. A regular employee will be the $10,000K, and the executives will be the 1-time salary. And the executives are already labeled in the database, so it will pull up the correct plans for them, because the term life, the group term life, and the long-term disability that's just for executives will only show for the executives. And then also new this year, they're going to be offering FSAs through TAF, the healthcare FSA, the dependent care FSA, the non-employer sponsored premium FSA I just found out, and I think the transportation and parking FSA.
Correct.
Right, and I believe they did have the healthcare and dependent care previously, but it wasn't well communicated. So in effect, it is a brand new plan for everybody.
So on the FSAs too, I want to go on the heels of that. They did not have debit cards with their prior FSA provider or third-party administrative provider. So you need to explain the use of the debit card, remind them that if they spend cash to pay for something as opposed to a debit card, for example, traveling to Sagebrush, Arizona, and the debit card terminal is down at the local drugstore and they need to pick up a prescription, they have to pay for it in cash because their terminal is down, then that means they're going to turn in a claim and get reimbursed. Just remind them that they can come home and fill out a paper claim and fax it, or they can take a picture of the receipts for that claim and text them to TASK. And regardless of how they get the information to TASK, when they get their $35 or $25 or whatever their reimbursement is, that money will come back to their debit card as a cash card amount of money that's sitting on that card. So the one card, just to remind everybody, serves as a debit card for paying for things, and anytime they get reimbursed, it's going to serve as the repository for the money for reimbursement. That means that if John, the employee, goes out and has money reimbursed to his cash card, he's now got money sitting there, and if he wants to buy something up to the amount that was reimbursed to him, and he can check the balances anytime he wants on his phone by looking at the TASK site. There's an app for it. He can swipe that debit card and he can buy beer, he can buy a hammer, he can buy movie tickets, whatever he wants to do up to the amount that he was reimbursed. Okay, just everybody will, yeah, oh, it's very cool.
Yeah, that's very cool.
Okay, now I can stay on the phone at the end, and I'll go through that with you guys again at the end, so I'll make a note.
That would be great. So of course, though, the employees still need to have smartphones and apps, and we know a majority of people do, but there are still some people that don't. All right, this group has opted. They want to continue doing just due, I think, to the makeup of their employees. They're going to continue to do the paper enrollment forms. So you will be assisting the employees to be sure their enrollment forms are completely filled out. You know, you all know applications, and we'll take a look at them when we get to the that section of the enrollment guide. You know, double check to be sure everything is there, that they didn't leave, that they're not missing any information like their social security number, the date of birth, the date of hire, their address, and that they also signed it in the correct spot. The ones that are existing plans, anybody who's staying on an existing plan, you know, obviously doesn't have to fill out a form, but anybody making a change or if they declined it last year and this year they're going to get it, they do have to fill out one of the enrollment forms. Kaiser doesn't accept our templates, and when there's only changes being made, lots of the other carriers don't really accept templates either. So that's the reason, one of the reasons why we're opting to go this route. And Patricia is going to manage the HealthNet and the AIG since they are new carriers. And so she will use the information from the enrollment forms and the information we give her from Harmony to get over to HealthNet and AIG. And we'll take a look at those. And yes.
Ask a question. When you say she's going to manage that, I just want to make sure I'm tracking. So an employee sits down, they're going to enroll through the benefit counselor the same as everybody else, or are we doing something different for? Yes, okay.
Oh, no,
and she's going to take it and push it on.
Yeah, I'm just responsible for sending over the elections to the carriers. So for HealthNet and AIG, I'll be taking that off of the group's hands.
Cool.
Yeah,
I was just verifying that there wasn't a change in the enrollment process. If there was, we just needed to make sure everybody was on the same page.
No, I'm going to get over to her our election forms and the Excel spreadsheet that comes out of Harmony, and that's what she's going to use with the enrollment forms to be sure she has everything she needs to get over to HealthNet and AIG.
Perfect. Thank you.
Yeah. Okay,
you know me, I'm a detail freak.
I know. and I'm going to get over to everybody. I think that's one document I didn't get over to everybody, that our missing information page that we use when we're using core applications, so that Patricia will be able to see very quickly any information that's missing from the application. And of course, for HealthNet, the 3 HMOs, they will, you do need to put down the provider. And Patricia, is it okay if they don't want to select a provider for them to just say they want a provider to be assigned to them?
Yeah, if you just put auto-assign, that would be great.
Okay, so we'll use the auto-assign provider.
Wait, physically, right? She just, Andrea, just said, Patricia just said use auto-assign. So, I mean, are we talking the 4 or 5 zeros, or are we physically writing auto-assign, or how does she want it?
Either way is fine. I'll be able to know out of your Harmony export if you have all zeros or auto-assign. I'll know that's what needs to be placed on the census.
Okay.
If there's nothing on the form, I'll infer from there that it's auto-assign.
Okay, thank you.
And then you will be able to see, and these are the exact same rates that are in Harmony. I sent over to everybody the benefit selection form that the employees, Dina still wants the employees to fill out this form. So each of the employees will have this form. And of course, my computer is whirling here and not opening it.
Just a point on the benefit selection form, Dana has already sent that out to individuals, and that was prior to them making the AIG decision. So on there, we do reference voluntary life and AD&D, so that is an error on the form, already been communicated.
Oh, that's right, because they just decided to offer. Here we go. Here's what the form looks like. So they just opted to include just life, not the AD&D on this one. So
correct. So on the bottom left-hand corner of this page, keep on going down.
There we go.
Keep on going down a little bit. Okay, so where that cost is right there, calculating your per pay period, you were almost there. Go down a little bit more.
Oh, down a little bit more. Okay. Oh, I see where it says voluntary life and AD&D. You gotta.
Oh, so keep on coming down a little bit. Keep going down.
Oh, this is on.
It's in that calculating your per pay period premium section. Keep going down. That's where it references AD&D. So if you can still scroll down a bit.
Yeah, right here. Here it is, involuntary life and AD&D. So to help the employees out, take your pen, take your pen and line, put a line through the AD&D because there's no AD&D for the voluntary.
Right. Yeah, so I think that's the only error on the form currently, and it's already been distributed.
Okay, and so then if they're declining, it's the same, here have them select, that they're declining, which benefits they're declining, and they also need to select on this form, the reason. And for medical, we'll be collecting the reason in Harmony as well. So, if they're covered on another plan, or if they're have their own plan, or other, be sure that we replicate it the same on both the sheet, this sheet, and what it'll say in Harmony. So they do have to, make their selection here, and as you can see by the cost, the Ludi Moss is the least expensive for the employee of the medical plans. So I guess that's what you were saying, Patricia, is that you think there's quite a few people that might migrate from Kaiser over to that HealthNet plan then.
Yeah, I think the price point's really going to be attractive to everyone.
Yeah. And tell them to keep in mind then that to keep those costs, they have to stay in that Salud HMO EMOS network, which is a more limited network.
Correct.
Okay, so then we're going to keep on going. So you can, those are the exact rates that are in Harmony that you see on that page. I made it easy to set up Harmony, and then I went through that really quick. Alrighty, so then the usual for our groups is to be sure that that you give the keep on showing them the salary illustration as they, so that they can be sure that they're comfortable with what's going on with their paycheck. At the end of the enrollment, Mike has the survey form to give to them. If we know there's bound to be a couple that will sit down with you and say, even though they've had the materials, they may need to go think some more, or go speak with their spouse. Just for the time being, just have everything declined in Harmony, and then when they come back, they can make their choices. Get there early so that you can be set up and ready to go. I think Dana said it was just going to be one big room where everything is going to take place, the meetings and everything. So you want to, each grab a spot in that big room, and like we always do, be sure the employees sit side by side so they see your screen, and have them create their password. So it's their password, not a password that you give them. And we just looked at that form right here, so be sure you have that benefit selection form that's internal to Post and Alarm. They should come with it, but is Dana going to have extras in the room in case employees come without their packets? Do you know, Patricia?
I hope that she will. So I'm going to try to get the final version that she distributed, and I'll make a few copies as well for the room.
Okay. And then I had to add a couple more things to my guide in case there's no red asterisk. I wanted to remind everybody that all those sentence waivers that we have are especially important to, so that don't skip them if there's not a red asterisk, there should be red asterisks on the ones that we have to do because, you know, in this time of the new ACA regulations, there's some things that we have the employee sign off on. Now, the employer wanted us to update all profile information. The census that I got was very basic, so for the most part, that information is not there. So, but double check any information that is there and add any information that's missing, because we're going to give a complete profile back to the employer so she has their current addresses, their current phone numbers and everything. And so just be sure that you update, you know, always double check the census, whatever's in there, to be sure that it's accurate. I think the only salaries that are going to show are going to be for the executives, because those are the ones that I received the salary information for, since they receive those additional benefits that the regular employees don't get. I will send you a copy of the CREA flyer that's already been given to the employees on the colonial benefits, and there's 125 employees in this group, so if we divide that by 4, you will know how many copies to bring with you to use in the group meetings, so that we have things to pass out. So that's, everybody should make about 35 copies of that page. The group has AFLAC. I did send to you the AFLAC invoice, and AFLAC is going away, so be sure to counsel the employees on what to do with their AFLAC and help those change over to Colonial who want to change over to Colonial. Wayne did give us credit for time insured for the disability. For those who currently have disability, when they switch over to Colonial, they'll have credit for time insured. And he did waive the 30-day wait also for cancer, since for those who currently have AFLAC cancer to switch over to Colonial. And then,
Andrea?
Of course,
and the,
yes.
And the payroll slot's going away. Make sure and mention, well, I did, so I guess everybody gets it. Payroll slot is going away, so they'll, if they want to keep a policy.
AFLAC is going away.
Yeah, entirely.
Yeah, so anybody, of course, who has, you know, pre-existing conditions or is currently in a claim situation with AFLAC, you will want to advise them to keep their AFLAC and convert to individual pay with their AFLAC plan. But other than that, you need to tell employees that the AFLAC pay slot is going away, and to continue to pre-tax their voluntary benefits, they need to switch over to Colonial. And then, once again, just a reminder about the forms that we've talked about that we'll look at. Well, now we're going to go down and take a look at the different plans. That the HealthNet, the AIG are new, so they have to fill out if they want them. The Kaiser, Meritus, and Premier Access are existing, so the employees only need to fill out if they are going to make a change. Alrighty, so let's go down, and we all know the forms that Mike likes to have in our folders, so be sure you have the forms in your folders ready to go when you sit down with employees, because it's going to go fairly quickly when we get, we'll talk about that after we talk about the plans. We'll talk about how it's going to, well, maybe we'll do that right now since we're on the schedule. All right, so the first day, we're going to have a meeting at 7:30 a.m., and that is going to be, I think, with the office
Correct.
staff. Now, the office staff, they're there all day. So if you have any, the staff that, you know, goes out, you know, the field staff, there we go, I think of the word, the field staff, anybody who comes in and is a field staff person has to have priority over office staff, because the office staff are there and the field staff are coming in to take care of their benefits. Now, we are having on the first day at 1 p.m. a specific meeting for the field staff, and they're bringing, I think they said, like between 25 and 30. They were trying to be bringing in at a time from the field. So we are going to, as soon as they do the meeting, they're going to, you know, 4 at a time, start sitting with each of you and rotate through to get as many done as we can. but there are some that aren't going to be able to stay because they probably have an appointment that I got to get to. So please have sign-up sheets available so that we can capture the names and the phone numbers of any of these employees, because we will be, you know, either using call center, calling them. We will, one of the days we may, you know, just go through these list of names next, you know, on Monday and Tuesday, utilize Susie and Patrick and those that have call center capability to go through and call the employees. So we don't want anybody leaving without putting their name and phone number and email contact information on a sign-up sheet. So everybody needs to have a sign-up sheet available so we can capture capture that information and sort of keep your eyes on the door so that we can, you know, get that information, and it'll also be stated in the meeting as well. So that
Andrea?
Yes.
Excuse me. Are they open on Monday? I see that's President's Day.
I'm not sure. We'll need to confirm.
Ooh, we better call Jennifer today and find out, Andrea.
Yeah, I didn't even think about Monday being President's Day. All right,
I just saw it.
About that. Yeah.
Okay.
Yeah, and it's a good catch. Didn't even think about that because we were talking in our conference call about Monday and Tuesday being days that we could come in as well to be available. All right, I'll call Jennifer over at the group and I'll send out an email to that effect. And then on Friday, the start time is going to be 7:30, and it's the time when those field people are going to come in again in a big, you know, in a big clump to hear the group meeting, and then as quickly as we can rotate through the benefit counselors and once again have their sign-up sheets so we can capture the name and contact information of anybody that that needs to leave, and because we want to still be able to capture their information. Now, anybody obviously that we are going to be doing on the phone or co-browsing, because Monica and Rodney will need to co-browse, and Margot, with any of these employees, you will be instructing them to turn in all their forms to Dana, because we really can't collect forms over the phone. But so that they know, and there will be a sign-off on our election form that they understand that they have to turn in forms. So that's how we're envisioning it, and so we don't, you know, we know employees will get impatient, you know, when they're with us. So, and we can instruct employees as they're waiting, you know, that they can fill out their applications so that when they sit down with you, it will go quicker. You know, so in the meeting, you know, we'll address that issue that while they're waiting their turn to sit with the benefit counselor to go through their packet, be sure any forms are completely filled out, that they, for any products that they're getting, the medical, the dental division, and the AIG. And all right, and so with this group, the plan effective date is March 1st. The first deduction, the for Colonial, will be March 22nd. Obviously, their medical, dental, vision deductions will start right away, and their FSA deductions. They have 24 paychecks and 24 deductions a year, and they're a AAA risk, which is good. For Colonial, we are we're offering for accident, we're offering the preferred and premier plans with health and off-the-job spouse disability rider. Because on the disability, we're offering off-the-job disability with Peggy collected up to $4,000. It's also capped at 35%. So we don't want anybody getting more than 100% of their salary if they happen to go on state disability. For cancer, we're offering the Cancer Assist with plans 3 and 4 and the $100 health screening benefit. Critical illness, we're offering the critical illness with the subsequent diagnosis and health, but obviously no cancer. The whole life, we're offering the we're not offering term life or universal life. Term life is obvious because they have the AIG term life that they can get, and then the whole life also has the long-term care rider, so we want to make that available. And then for Medical Bridge, we're offering the Plan 2 with the level 2, the $1,000 for hospital confinement, and then the option 1, 500 tier 1, 1,000 tier 2 for the outpatient surgery. So those are the colonial plans that we're offering. And then
note on Andrea, quick note for everybody on disability. More than likely, Dana didn't know, but more than likely, Aflac was offering up to 40% of their pay because I have found that they never offset what they offer by the amount of long-term disability or group short-term disability that's in place, which should be done. Like we did here. So if somebody says, well, I had 40% before, just explain that management didn't know that 40% was offered by Aflac, and had they known with the LTD in place that it would have been 35%. But because it's front and center, we need to not over-benefit each employee, like Andrea explained. And so moving forward, the max is 35%.
Got it. Okay, and then they are offering the FSAs, medical reimbursement maximum, as you know, is $2,550. The dependent care is $5,000. Transportation has changed. It's the parking. It's separated now into transportation and parking, or transit and parking. Both of them are $255 a month max for anybody who, which with this group, I highly doubt that anybody's using transit, because they probably travel with their vehicles for the locations that they're going. But in case they do, they can do up to $255 a month now, and also with parking. So
actually, Andrea, if I'm not mistaken, Dana told me that there is a train station across the street or someplace really close by,
okay,
like that.
So they may be using.
Yeah. Yeah, okay. And also keep in mind, too, just a reminder, transportation it also includes mass transit. It doesn't mean riding with your friend and giving them gas money. To qualify for transportation, it has to be a vehicle that carries 6 people or more.
Yeah, and I think it doesn't have to be one of those van pools or something like that.
Yeah.
So it's like Mike said, it's not just get together with your friends to carpool. So, yeah. And then the parking, of course, you have to be paying a parking garage or something, having your receipts for that as well. Not just parking on the street. Same. That's it. All right. So now we are down to medical plans. So like we said, Kaiser's an existing plan. HealthNet is new. Employees only need to fill out a Kaiser app if they're adding or making a change, but everybody who wants HealthNet has to fill out a HealthNet application. The HealthNet, the Kaiser plan is the Kaiser HMO. It's an HMO plan that there's no calendar year deductible. The out-of-pocket max was $1,500 for an individual, $3,000 for a family. The doctor's office visit copay was $25. The hospital care was $500 for admittance. The outpatient surgery was $100 per procedure. Emergency room copay was $100, and their prescription copays were $15 for generic and $35 for brand. But you saw on the benefit selection form for post-alarm that the costs for Kaiser are more than some of the HealthNet plans. So, but there are a core group of people usually who like Kaiser and want to keep Kaiser. So you'll have to just be flexible with the employees when they come. Then there are 3 HMO HealthNet plans that are new this year. They have the HealthNet Excel Care EOA plan, and that uses the Excel Care network when you're looking for the network. It has, Patricia, can I have you explain this one, because there's the HMO, if they're going through an HMO network versus the PPO network.
Sorry, trying to unmute. Yes, definitely. So for the Excel Care network, it is still a narrow network. It's not a full network. they are able to see a self-refer to a PPO specialist. That's where that $40 PPO copay comes into effect. So they are able to self-refer to that PPO specialist. However, if any procedures need to take place, they would need to go back into the HMO primary care physician and within the HMO network to have those services performed. So it's just for a referral to a specialist is where the ExcelCare allows them to do so. I'm seeing on that SmartCare section on the page here, it's benefits. So I'll get with Andrea to update this document. There is a chiropractic benefit available on the SmartCare network. And that's allowing a $15 copay for up to 10 visits per calendar year. And what I see here, the prescription is a little bit off as well. So there is a deductible. It's 15 generic, 30, 50 for non-formulary, and there's a $100 brand and non-formulary deductible on that SmartCare. So,
okay, and I was looking at the plan, the little 1-2-page plan summaries that you sent me. So I'll.
Yeah. So I'm looking off of our proposal. So we'll offline this and update it accordingly, and then get it back in front of you. And then on the Salud plan, it does allow Salud network is in California. The SIMSA network is in Mexico, and so as you see here, it's to go to an office visit through the Salud network, it's $30. However, a office visit for the SIMSA in Mexico is a $5 copay. So the deductible or out-of-pocket maximums are not cross-applicable. The $1,500 and the $4,500 for family, they don't cross-apply, it appears. And let's see, I think everything else looks good there.
So they work separately. So if they're using both networks in California, and if they happen to be in Mexico, the SIMSA network, the out-of-pocket maxes don't combine together. They
right. They don't cross-apply. Right.
Oh, okay. Got it.
Okay.
All right.
As far as the HealthNet documents are concerned, there is the application that we'll need assistance to gather, and there's also a HIPAA and arbitration clause in there as well that HealthNet is requesting everybody to complete that is enrolling in the plan. So we'll make sure that that's highlighted for you.
Is this page here, that electronic enrollment signature page that everybody needs to sign?
I believe so, yes. Yes.
Yeah, that.
Yep, so those two will be required of everybody enrolling. And then.
So this is the HealthNet, that signature page. It's separate, and it's basically an agreement page that they sign.
Right. That's the lawyer speak for covering bases. So for everybody that's enrolling, they'll need to complete this document. And then as they're waiving coverage, HealthNet would request that the declination of the enrollment form is completed. So everybody will have to fill out a HealthNet form if they're not enrolling in the Kaiser plan.
All right, so here's the HealthNet form. And
let's cruise through this enrollment form to see if there's anything that stands out as unusual that we'd want to get some explanation on.
Yeah, that's what I'm doing. Patricia was nice, and she highlighted for us, so that's always good. What is the employer group number?
That has not been assigned yet, so you can leave that blank. Requested effective date will be 3/1/16.
Okay.
and the post alarm system is the employer name. But all of these documents are going to stay internal at Post, so they can be as messy as they need to be.
Okay. Oh, you shouldn't have said that.
Hey, well, I used to work in a hospital, so I totally understand how doctors write. So I can handle anything.
All right, and you can, now on here, when they're doing the selection, we can see the SmartCare HMO, the Saluti Moss HMO, and the ExcelCare HMO, but you also have over here EOA and ExcelCare EOA. Is it the,
right.
is the ExcelCare EOA, correct?
Correct. So it'll be ExcelCare EOA. It will be the SmartCare HMO, and then Salud HMO EMOS. So those three is what you'll select.
Those three.
If the other ExcelCare gets to be clicked, it's not a deal breaker. We only have that one ExcelCare plan that we're offering. And then on the PPO, then just click off PPO for those few that would like to come onto that plan.
Okay.
And then, question. What did you say but between the ExcelCare HMO2 and the EOA3? I'm sorry.
The ExcelCare EOA2, that one is the proper one to select.
Okay.
However, if the ExcelCare HMO2 gets selected, it's not a deal breaker.
Okay, thank you.
Mm-hmm. Then you're going to go to number 2, the reason for application, and just do open enrollment there. And then come on down for number 3, the employee personal information. So as much information as they can provide. Again, we're working off of what's in payroll, but this is another way of double checking that we have good information in payroll.
Patricia, what is a matricular ID? I don't think I've seen that term.
Matricular ID. I think it's for the for those that are maybe residing in Mexico. There's a separate ID number, I would believe.
Okay. Okay, got it. Yeah, I just Googled it.
I'm just pulling that out of the sky.
Because they have the Saluti Moss network.
Right.
They have the Saluti Moss network that they can use in Mexico, so they might be getting that because they still have somebody who lives in Mexico, maybe.
Right.
Wow.
Alrighty.
And then so down here on the bottom with the primary care, the PCP enrollment ID, that's where you would throw it. If they have the number, that's great. If not, then just make sure that either the primary care physician section is completed or a physician group is listed. If there isn't an enrollment ID there, having those other clues would really help to get them into that primary care physician that they want to see.
And that's where you can write auto assign if that's the route they're going as well. Since HealthNet is new, they might not know what doctor that they want to have.
Right. And then on page 3 is where you would place the any dependents that they would like to cover.
Well, this is the personal information. When you get to number 3, then number 4, this page is where you would, add the spouses and the dependents that want us covered.
Right.
And these are the forms that after the group meeting, hopefully some of them will come with the forms filled out. But at the group meeting, we'll ask them while you're waiting your turn with the benefit counselor to start filling out all of these forms. So that at least when it comes to sit with you, hopefully a lot of it will be filled out, and you just need to double check that everything is there. Otherwise, while you're going through Harmony, also have them, start filling out forms while they're where you're going through all the benefits in Harmony as well. And then, and the section, do you need the dependents have other health coverage? Do you need this section filled out with the?
Only if they're enrolling that dependent, then you would need to, if there is other health coverage that's being continued, then yes, the section would need to be completed. There's not many that applies to. And then if we go down to section 6, what that one looks like.
That one doesn't. the group term life that's not through Health Net, so that doesn't apply. And then
I'm looking for a waiver section.
and here's section 7 for all the, because you said that they want everybody to sign, so if they're continuing on Kaiser or they're declining for any reason, everybody has to fill out section 7, the declination of coverage if they are not getting Health Net. So some of them might just have section 1 and section 7 filled out.
Yeah, and for those individuals that are on Kaiser, I wouldn't even bother with the Health Net form because we can show that they're enrolled, through Post for Kaiser. So that'll save you a step in front of them. So I would only, pull out the Health Net form if they are not electing any medical whatsoever. And then obviously if they're electing into Health Net. On that declination of coverage section, many times employees just love to sign wherever it says employee signature. The Health Net is very particular, so if we ever have to provide these documents to them, just make absolutely sure that that if they're not declining coverage, don't sign in section 7. If they happen to, just have them cross it out and initial that it was an error or grab a new form.
Yeah, because section 8 is where they fill out if they're getting, they sign in section 8 if they are selecting Health Net, they sign in section 7 if they're declining Health Net. So
correct.
And so that's true. Some of them might see signature and they just scribble the signature, but you can see right here, if signed in error, it says please cross out an initial. So at least they give you that option on there.
Yep.
And so that's the Health Net form. Does anybody have any questions? Alrighty then. And then I think we had left, we didn't do the PPO. They did have a PPO plan through Health Net as well. As usually happens, the PPO is a little bit more pricier, but it is available. It has the calendar year deductible $500 for an individual, $1,500 for a family, and I will update these little descriptions with the new information that Patricia sends over to me. And like I mentioned when I first sent out the guide, that there's always corrections that have to be made after a training call. So I don't print it until you get the updated one. I'll get that out sometime today after I receive the rest of the information. And then the co-insurance on the PPO is 10%. So they'll basically, for most things, they'll be paying 10% for hospital, for outpatient, for which is where the majority of the expenses come in. Their doctor's office visit is only $30, and then you have their prescriptions.
And on this, I just note that out of network, it's covered at 70%, so it'll be 30% out of network. So if we want to just do a slash.
Okay, I'll do that there. So out of network is, instead of 10%, it's going to be 30%. So all of these will end up 30% if it's out of network. Well, we all know out of network. Most of me, I always show that the in-network costs, out-of-network costs are always more.
Yep.
All right.
And then there's also chiropractic on that PPO plan. So I'm not sure if that was listed there or not.
Okay. So that's good. I'll add that when I'll take a look at any updated plans being sent over to me and get everything out. And then their Emeritus VSP Choice Network is an existing plan. Now, lots of times, let me pull that up. I saw it on here. So lots of times Vision doesn't do an enrollment form, but it looks like Emeritus does have an enrollment form. So if anybody who wants Vision needs to fill out this enrollment form if they're not currently on the Vision plan. Is that true, Patricia?
Yes, it is.
Okay.
Okay, so we need to fill out Kaiser forms for anybody who enrolls in Kaiser. We need a Health Net form filled out for anybody who enrolls in Health Net. We need a Health Net form filled out for anybody who declines Health Net, and we also need paper for Emeritus. So far, so good?
Yep.
Perfect.
So far, so good.
Can I confirm something about that? Just because there were two different things said, back to what Mike just said. originally we said Health Net for everybody who declines, even if they're taking Kaiser, and then Patricia, though, just said if they're taking Kaiser, they don't have to fill out a Health Net for a declination, correct?
You are correct.
Okay.
That saves you one step. Yep.
All right, so and here's the Emeritus form, and of course this is an existing plan, so anybody who currently has Emeritus does not have to fill this out, and you'll see that under existing coverages. So when you see that they currently have VSP, and if they say they want to select the same, then you just select the same in Harmony, but you don't have to fill out one of these forms. And it's just a basic form here. Basically the same thing that you're putting on the other one, and you have your dependents here that you need to add if they're covering their dependents, and the signature down here. And that's for anybody that's enrolling it. But down here in section 2 is where they put changes. So anybody who's currently on it and they're going to put changes, they just have to fill out the section 2 part. Is correct, Tricia?
Yes.
Okay. Do you need waves? But they've already captured the waves for everybody, so this is just for changes, so they don't have to do the waves. And then well, they got tips for filling out the form. And then on this one, you can see the signature. It looks, man, my computer just doesn't want to cooperate today. You can see the signature on this one it looked like it was right here in the middle of the page. So there's where they sign, and that's whether they do enroll or do changes, because I didn't see a signature after section 2. So is that the only signature spot right there in the middle?
Yes.
Okay. Alrighty. So this, and then when you look at the description, it's a basic vision plan. The exam deductible is $10. The lenses or frames deductible, or materials deductible is $25. Basic lenses are covered in full. Progressive, of course, have additional costs, and different finishes have different costs. Frames, it's at up to $100, and it's a Costco allowance. So is Costco the only place they can go to get it, or can they go get their glass frames anywhere?
They can go anywhere. It's just an added perk to allow Costco as an additional vendor in network.
Okay, so that's why. So the Costco is now places they can go. Okay, and then contacts are up to $115 allowance. For elective contacts, and anything that is medically required is less. And then the schedule is, every 12 months for an exam, every 12 months for lenses, every 24 months for frames.
And this is, there is no change from 2015 to 2016 on this plan.
So the cost remains the same?
Remain the same, and cost as well.
Okay, and then they have their dentalists through Premier Access. They have a DHMO 500. It's an existing plan, and it has, I just put a couple of things here, but it has the schedule of benefits, where you can look at to see all the different costs. But it had preventative costs ranging from $0 to $25, basic costs ranging from $0 to $250, a major cost. Well, I think it's going to have to be more than $165, but on the one sheet I was looking at, that's what it said. And then it had ortho included. And then the Premier Access PPO Plus plan number 6 is also an existing plan. And then in this one, it looked like they could choose the PPO network, and then they had the PCN network, which was is a PCN a narrower network, or what was the
yes, it's a narrow network. It's primarily dentists that just come out of dental school, so trying to build their book of business. So they'll accept a lower reimbursement rate. So it's a bigger bang for the employee's dollar to go into that network.
Okay. And so if they just use the regular PPO network, the basic is 80%, or if they use PCN network, it's 90% for basic. And so it's less out of pocket for the employees if they use that PCN network. I used to go to dental schools for my dental. It wasn't bad.
Yep.
And then
the deductible is also waived for preventative, so you may want to make a note to that as well.
Okay, I'll put that in there. I'll add that, and I'll add the corrections when we're offline here, and then send that out. And then the dental, of course, has, where did that go? Here it is. There's the Premier Access application. We'll just take a look at that real quick. And of course, this is only for employees that are, again, just making a change, or if they're adding it for the first time. And so you can see on this one, and they don't have to fill it out if they're declining because that's already been done. So the only time the employees need to fill out the Premier Access for dental coverage is if they're making any kind of change to their coverage, and you can see their current choices in the under existing benefits. And if they're making a change, then they need to fill out this application, or if they're enrolling for the first time. And so you can see they would fill out this box, the reason for enrollment change, and then as usual, they would need to add all the subscriber information, and then if they're going to add, their dependent information, if they're going to cover any dependents, and then their signature at the bottom of the page. And so it's a quick, easy form, and they all have these forms already in their package. They all been told to have their employee, their spouse and dependents, Social Security number and date of birth. So hopefully they're listening and come with that information. And then I was trying to explain, here we go, for the new plan, the AIG basic group in life and A, B, and D is $10,000 is the basic plan that the employer is paying for all employees, except the executives that get one time their salary, and it's capped at $125. And I listed the executives and their salaries here so you can see who gets that. And the salary should already be in harmony, but if for some reason I just wanted it there so that you are able to do it real quick if you needed to. And then anybody can buy up and get additional life insurance, and the employee can get $10,000 increments up to $300,000, not to exceed 5 times their salary, and the guaranteed issue is $1,000. The spouse can get $5,000 increments up to $150,000, not to exceed 50% of the employee amount, and the guaranteed issue is $20,000. And the children can get a $10,000 plan that covers all children, and of course the guaranteed issue is $10,000. And since this is the first time with this plan, this would be the opportunity to get up to the guaranteed issue amount for the employees without having to fill out an EOI form. And then I'm still waiting on this life form and the EOI form that Patricia hopefully will get over sometime today. Correct?
Yeah, you would hope, huh? Are we having meetings tomorrow or what? Yeah, and I apologize.
Fingers are crossed.
Yeah, I know. Having decisions made very close to the open enrollment meeting, that's what's delaying everything. So they're being proofed right now, so as soon as I get the PDF, you'll be the first one to hear it from the rooftop.
Okay, and the one question I do have on the spouse in life insurance, on the proposal that you sent over that I used for the rate, it didn't tell me if it was based on the spouse's date of birth or on the employee's date of birth. If you could get me that information so the database is set up correctly, I would appreciate it.
Yep.
And then the last benefit is the long-term disability, and that's only for those executives. So of course the salary needs to be correct for them because they'll get up to 60% of their salary, max benefit of $6,000, and the elimination period is 90 days. Is there anything else that you wanted to share about the long-term disability or any of these AIG plans?
It looks pretty good.
Okay. Does anybody have any questions on any of these? I don't have the AIG application to show you because they made their decisions, what, yesterday? Is that what? Something like that. And so, like Patricia said, she's in the process of getting that, and we'll get it to you as soon as we get it.
I have a question.
Have any?
It's Susie. I want to go back to the colonial disability and what we talked about, Mike, of Aflac offering too much at 40%, and they should have been offset due to, I wrote LTD, but they don't have LTD. So are we talking just about they didn't offset for state, or is there something else?
No, Andrea, go back down to LTD if you don't mind.
The executives here, they have LTD.
Yeah, but you're talking about the employees. If we need to explain, they say, oh, Aflac, I had more with Aflac. We were to explain that it was offset. So are we saying that? Go ahead.
She's right. I assumed that this was executives own. This was all employees that had LTD. I guess I missed the executives only part in my earlier meetings with Dana. So we set 35% based on that. Why don't I call? I'll get that fixed, because in an Aflac conversion, we really need to match, if it's possible, what Aflac offered, because we don't want to raise the hackles of our employee clients. So I'll call Jenny Lee today.
Okay, and if we do change it to 40%, remember to keep it at 35% though for any of these employees that are executives and they have LTD, because their LTD kicks in after 90 days. That's not a very long period of time. You know, so their elimination period is 90 days. Okay, anybody else have any other questions? We'll get.
Let's see.
I do. So Andrea, there's a universal enrollment form. Did I miss it? We went through that someplace?
Yeah, that was that. We opened it up already. That was that. It has the. Let me go back to it. It's yeah, we looked at that. That was the first document.
The benefit selection form.
How did I? Oh, you know what? I bet happened. I was on the call only, and I didn't open up the. I didn't open up GoToMeeting, and I bet you I missed it because I opened up GoToMeeting actually well after the call started. So my bad, but great, we covered it.
Yeah, that was the first one we went over.
Right, thank you. And then the next thing, the only other thing that I have is we have a process for, if you remember, scrubbing paper forms, and then we have a cover sheet for those that are incomplete and why, and those that are complete. So it takes less effort for those involved after us. So would you just review that real quickly?
Yeah, I told them that I was going to be sending the missing information sheet out to them, but we'll look at it real quick so that so everybody.
I apologize, but I'm going to need to jump off the call. Andrea, I'll go ahead and reach out to you and get you the additional information that we're missing. Okay,
yeah, and I was just going to tell you that we're good. So
awesome.
You went over all the plans with us, and now we just have a few internal things. So thank you so much.
Perfect.
For on the
call. All right, guys. Thanks so much for helping us on this one. All right. Take care.
All right. Bye-bye.
All right. Bye-bye.
All right. So yeah, as like Mike said, I was going to send out to everybody this missing information sheet. So have a bunch of these printed so that you can attach them to any app that you do.
No, that's Patricia left. That's all it is.
That's all that was. This is not the one I wanted. Wrong one. And of course, my computer is being slow. While I'm pulling this up, Mike, can you go over that?
Yeah, basically what happens is we've got two forms, and I'm sure everybody remembers this, but it's just from a quality perspective, it's good to review it. So if there is information on an application that is missing, here's the form, missing application info tracking sheet. What we want to do is we just want to paperclip or staple, whichever is easier, this on top of that set of applications. So when we hand it off to the broker or to the client, they're not having to go down through and find out what we already know is missing. So we just put cryptic, short, clear, legible notes under missing items. So if there were 3 things that this employee didn't have, like spouse social security number, like home address, okay, I'm being funny, those things need to be listed because that way this is to make us look like, man, we're really Johnny on the spot, and we're really making it easy on our broker and on our client. That's the only time this form is used, is on when we have an application where that paper app is incomplete.
Yeah.
The other form.
And most of the time is what's missing is going to be the employer, spouse, social security number, date of birth, and primary care provider are the most common items that you're going to be listing there. But anything that the information that the employee didn't know listed here. So because Patricia said they're going to basically keep the apps internal, Patricia's going to handle the AIG and the help desk because they're new using the information that we send over, but they were not comfortable giving up paper apps. So we're stuck with the paper apps with this group, and because the Meritus Vision and the Premier Access Dental are continuing the same, Dana will input the changes into those carriers, but they still wanted the paper apps. I think after they see our election forms and realize that we capture all of the same information, they'll be more comfortable, but they just weren't comfortable giving up paper, which is sad. But I'll send this out, just have a bunch of these printed so that it'll be quick for you to grab and attach to any application that you need to. Now, if they've been informed to come with spouse and dependent social securities and date of birth, if they do not have it, we want to be able to get the enrollment done. Please use the same number, because I don't think it pulls up that you've already used that social security number if it's just for a spouse or dependent. So use something that I can tell 1, 2, 3, 4, 5, 6, 7, 8, 9, or 2, 2, 2, 2, 2, 2, 2. Because when you start getting, I don't know, fancy with them, I can't tell if it's a obvious social that I need to delete from the census. So please be very obvious if we have to do that as a placeholder. And the same with birthdays, 0101, 1990 or something like that for kids, so that every time I see 0101 1990, I'll understand it is false. But I'll shoot me an email also with any people that you may have had to do all social or something as a placeholder to continue with the enrollment. Now, real important, I'll send over a sign-up sheet to everybody as well, is to be sure to capture the names and the phone number, contact information from any of these field employees that can't sit and can fill out, because they're supposed to be able to come they have 4-hour blocks, I think it was, that they're bringing in these field people for. But hopefully they'll all be able to stay and we'll be able to process them. But anybody that we can't, just don't let anybody leave without capturing their information. And then those are the sheets that you guys can use to follow up with those people and enroll them. And they'll just be, you have to be told, since we obviously can't collect paperwork over the phone, have to tell them that their enrollment is not complete until they turn in their paperwork, and that will also be a sign-off statement that they'll be signing off on if they understand that core paperwork has to be turned in to complete their enrollment.
Let's talk about this. Andrew, just real quick, you mentioned the second groups and things like that. So, short recap, we got the office starting tomorrow at 7:30, and there'll be a group meeting, and then we can start pulling from that pool. And then at 1 o'clock, there's going to be a group meeting again, and because a bunch of these outside folks are coming in. The first group of 2 are coming in to process their open enrollment. So second group meeting at 1 o'clock, and these folks are going to be there till 4, and there might be some people who hang around. I don't know. On the 12th, we do the same thing starting at 7:30 to 11:30. So there's going to be outside folks who come in, group meeting at 7:30, and they'll hang around, and these are outside folks until 11:30. So we wanted to do the office first so we could have this pool to draw from. It's only 15 people, and we've got enough of you here to consume them pretty fast. But here's going to be the trick, is just as Andrea indicated. These are outside folks, you know, they're blue collar. It's, you know, what a pain in the butt. I got to come in, I got to do this, I got to hang around, I got to wait my turn. You know, we all know what that is. So if you can just work together to keep it as organized as you can, and that everybody has a process. Each employee knows what their next steps are. If they're not going to be seen that day because they couldn't hang around or had to leave, or we didn't get to see them at 4, make sure they know that what the next step is. And as long as we keep that organized, it's going to create good feedback to HR, HR to the broker, and broker to us. And a word about the broker. So Tapert is a member of, is one of the 4 members of Benefits America. So let me just kind of recap for you something that started last year, because I want everybody to be really on their toes, well, always, but maybe especially on this one. So last year, 4 brokers got together and formed a group called Benefits America. They still go out to the marketplace as Venbrook Insurance, or this group's broker, Tapert Insurance Agency. There's a 3rd one, Orion Risk, and a 4th one, J.D. Gilmore. Venbrook Insurance last year did a little over $738,000 in business with Colonial last year. We did one group with Tapert. We have not done a core enrollment for Tapert. So this is going to be Tapert's opportunity to see live everything that Venbrook has been telling them, how good we do on core enrollments. So this can be a door opener. So we can, and then once we have Venbrook and Tapert who are actively feeding us, you know, groups, that's going to kind of press the other 2, Orion as well as J.D. Gilmore, to follow suit because they're rather competitive. My point is, Bob Cornson asked me to send out an email to all 4 of the members talking about how much premium was written from Colonial in Benefits America, and he said, and break it out by members. So here was a chunk from Benefits America, a small amount from Tapert because it was one group, and none for Orion and J.D. Gilmore. Within 2 hours of that email going out, I got emails from Tapert and from Orion Risk for proposals on 3 cases, totaling on those 3 cases about 1,000 lives, because it's a 384, 450, and about a 65 life case. And so, anyway, I just wanted all of you to know that there's some competitive synergy at work here, and if we just knock this out of the ballpark for smoothness, accuracy, good level of communications, you know, everything going the way it's supposed to, all it's going to do is bring more to us. Yeah, buddy. Back to you, Andrea.
Okay, well, I'm basically done. You wanted to share a little bit more about the FSA.
Yes, I have FSA, and at the after the FSA, I want to talk a little bit more about the California Small Manufacturers Trust and kind of some things that are going on there that are in our future, which is very, 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 very big news. All right, so flexible spending accounts. I'm just going to do a quick review. So they had FSAs at this group. So this is important for you to know because an employee might ask a why question. They had FSAs, but their FSA had a 1/1 or January 1 through 12/31 plan year, while their medical, dental, vision, and everything else started 3/1. They also had an AFLAC 1/1 plan year, while their medical started 3/1. So they had different cycles for open enrollment. So I recommended to them and to the broker that we break this into one enrollment, so we could create an opportunity to do core because we always write more premium when we do core. 2, it's easier on the employees. This is key. It's easier on the employees and it's easier on the employer when there's one enrollment as opposed to 2 or more. So because of the way FSAs work, rather than do a 2-month short plan year on the flexible spending account, in other words, January and February is a plan year, and then stop, and then restart a new one from 3/1 through 2/28 the following year, which is what we're doing now. Rather than do that, they just took FSAs and they stopped their FSA at the end of December. So for January and February, employees have not had any flexible spending account program with which to run their expenses through. They're starting a new plan year, 3/1, as we covered in the meeting, and then it'll run in 12-month cycles. So from now on, everything is going to be open enrollment at the same time, 3/1 through the end of February. What I need you to remember is that they did not have an FSA program during the month of January and February. So employees cannot save up receipts from January and February and start accounting for them in March because they're dated receipts. They did not have a program in place during January and February. So they're only going to have the ability to run expenses through the FSA that start 3/1 through the end of February in 2017. So let's stop there. Is everybody clear on that?
Yes.
Okay. So the next thing, they only had dependent, and this was covered, they only had dependent care and daycare and so forth. Now we've added transportation and non-employer sponsored premium. So, this is training time, so there's no bad question. So does anybody want me to review transportation?
Why don't you, Mike?
Okay, sure. All right, so the government says that if an employee takes mass transit in order to get to and from work, they're going to have, they pay for it, then they can run those expenses through their flexible spending account, which basically means, so let's create a scenario. Johnny rides mass transit or a train, from his home in San Clemente to get to work in Simi Valley. And so let's say he pays $350 a month for that transportation. The government provides for the employee, if their TPA offers this service, which TAP does, to take up to $255 a month of those expenses and run them through their FSA at work, which means they can pay for those expenses on a pre-tax basis, not a post-tax basis, if they did not have an FSA. And it's the same thing and they manage that the same way they do health care or dependent care. They have to sign up for a transportation account, FSA. They predetermine how much money they want to have taken out of their paycheck. That money comes out on a pre-tax basis. That money then goes to task and it sits out there until the employee files a claim or swipes a debit card or uses their debit card in some way to pay for the expenses. So they can use a debit card or they can pay cash and get reimbursed from their transportation account, FSA, which means they got to pay for it with pre-tax dollars, not post-tax dollars. This is straight positive for the employee. It is straight positive for the employer because it creates tax savings for both. Unlike health care, the employee can change their deduction amount anytime during the year because transportation costs may vary. Same thing applies to dependent care. An employee can go in and change the amount they have taken out of their paycheck for dependent care. Once again, with health care reimbursement, the biggest bucket of the flexible spending account program, once the employee picks how much they have taken out of their paycheck, they cannot make any changes during the year to that amount unless they have a qualifying event. we all know what those are. So then they can go to HR and they can say, hey, I just had a baby and now I want to, have more money taken out of my paycheck or less money, or I got divorced, I want less money, whatever. So out of the 4 programs, healthcare is the only one that you cannot change the monthly deduction unless you have a qualifying event. All the other 3, you can change it by just going to HR and saying, starting next month, I need my deduction for transportation or whatever it is to be this amount. And they'll change the payroll deduction and everything stays the same. The only thing we haven't talked about is non-employer sponsored premium reimbursement. That basically is this. These employees are going to be enrolled in medical, dental, and vision stuff, benefits through their employer. But what about somebody who has, for example, a wife or a husband who is enrolled in a medical plan or a dental plan or a vision plan or an orthodontia plan that they signed up for, and it is not one that is offered by their employer, but it's one they signed up for separately, okay? So that means they're paying for those premiums with dollars, compensation dollars that they receive from their employer, but they've already paid payroll taxes on that. So the IRS says that a TPA, task in this case, can offer a program that's non-employer sponsored premium reimbursement that allows an employee to run non-employer sponsored premiums through their FSA, thus allowing that employee to pay for those premiums with pre-tax dollars. So let's put that in the scenario. So let's say Rodney Shepard is the employee of Post, and he has a son who's going to school in San Diego, and they have to have a separate medical plan which is not run or sponsored through their employer. And that plan costs $200 a month. Well, Rodney would have to earn about $250 a month to pay $50 in taxes, so he'd have $200 left over to pay for his son's medical plan or dental plan or vision plan or orthodontia plan or whatever it is. All he has to do is he signs up for this. He predetermines how much he wants to have come out of his check. That money goes to task. Task, sits on the money. And then once a month, when Rodney pays his premium for the $200 for little Rodney, then he writes that check, and then he takes a picture of that, and he turns that in to Task, and Task reimburses Rodney that $200 because it's been sitting there in a pre-tax account that's already been deducted on a pre-tax basis, and he sends Rodney back his $200. In other words, Rodney did not have to pay the $50 in taxes. I used a 25% tax rate, state, local, and federal combined on that. So that's what that's all about. Once again, the debit card serves as the holding tank for money that's reimbursed anytime somebody pays for something, and they do not use their debit card. Okay, so that's kind of a quick overview. There are documents, that Andrea's got here. Participation rate on flexible spending accounts is between 10 and 15%. So print documents accordingly. Don't print 85 sets of these. Rather, I think this is a 6-page document. It's crazy.
Yes.
So if there's 125 people, 10% is 12, plus half of that again is 18. So we really only need, I would say, 20. And if you had to, you could print 1 or 2 extra on site if you had to. So I'd bring 20 between all of you. So each of you have, what, 4, 5? And that's all you need to be able to review that.
Mike, I have a question.
Yes.
Okay, I want to go back to the non-employer sponsored premium reimbursement. So what that means in my brain is and please correct me, if
Sure.
they're paying for it. In other words, they have an individual plan, they went on their own, because their employer did not offer it, or is it just because, is that the only reason, or can they just say, well, like my employer offered one, but it's too expensive, I'm going to go get my own online?
Really good question, but this has nothing to do with ACA. and you're thinking about the requirements of ACA, which would be quite natural, you know, which is if my employer offered it, I can't get the subsidy from the exchange.
So it doesn't matter.
Yeah, no, it doesn't matter. If it is a health, if it's a medical, dental, or vision related benefit for a dependent or self, you can run those premium dollars through the FSA. Good question, though. Yeah, good question.
I want to go back to transportation. My understanding of this is not only can they change it, but they can stop it and start it whenever they want to. And they can...
Go ahead.
And they can only use what they've put in. They can only use it at the end of the month that they put it in, like the dependent care. That's what I was told what we do on Spark.
Okay, cool. So let's address that. And I want to expand what you just talked about. I'm going to go backwards, though. Healthcare, of the 4 buckets of benefits that the FSA offer, healthcare is the only one that the employee can pre-spend. Starting day one, they can use the entire $2,500 bucks. Okay?
Yeah.
$2,550. Everything else, as you indicated, you can only spend the amount of money that you have placed through payroll deposits into your account. So on day one, you've got no money in there for dependent care, transportation, non-employer sponsored premium. You have to wait until a couple of pay cycles so you've got some money in there so you can spend that money. And if you're down to zero, you don't get to, there's nothing there. Okay? As far as enrolling in transportation during the plan year, I don't know the answer to that, but it's a fair question, and I'm going to find out, and we'll get back to all of you.
Okay.
Yeah, and just remember now that the two are separated now. They're not combined together. There's a separate FSA for parking and a separate FSA for transit. They used to be combined
Andrea,
into one.
When did that transit go up? I'm still going by 130 a month.
It just went up last month.
Yeah.
Oh, okay.
In January.
Yeah. Yeah, it just went up.
Okay.
Yeah.
Okay, thanks.
So I do have some that I have to correct and that are already, you know, so if you do happen to have an FSA account that does, and somebody that uses that one, just remind me when I refresh to update the transit, because I forget about it because it's changed.
Okay.
Okay, and so yeah, so you know, just have one of these, you know, printed out, this 6-page document, or you know, like Mike said, maybe 4, but keep one that you don't give away, because you know that they're going to come and ask, oh, can I cover, you know, they'll ask a question on something that they think is covered. Oh, you know, can I cover my medicated shampoos? And you can see right here, no, medicated shampoos are not covered. You know, they're not eligible, or diaper service is not eligible. You know, so at least if you have this, you'll be able to look at it and answer some questions that they, you know, because some are trying to think, they want to get it, trying to think of what they spend money on. You know, see if it's something that they want to do.
Can I make a comment on the process in general, Mike? Because I'm listening to what we're going to be doing tomorrow. You know, you were talking about it's so important with Tapered, and we get that. And we're going to be 4 of us busy with these field people trying to get them in and out. But at the same time, you're saying, well, we want to make sure that if they leave, that they put their name on a list. Are you going to be there to facilitate? I mean, this sounds like something that a facilitator would be really helpful, especially if you want it to be that great for Tapered.
Unfortunately, I can't be there all day, or both days. I just can't. I am going to be there in the morning for a couple of hours, but I wish I could, but I can't. So I'm going to be asking Patricia to, excuse me, not Patricia, Dana, to help. I think the big thing to do, honestly, is during the group meeting, we need to, because that's when you're going to have everybody's attention. And right then is when we need to say, there are 4 of us, there are 25 of you. We want to try to get through everybody that's here, but if you have to leave before you go, we need to make sure your name's on a sheet. So I'd pass around the sign-up sheet right in the beginning. and make sure that you have everybody's name, their phone number. I don't know that you need their email address, and you need to reinforce that they have to enroll or waive. I mean, there's paperwork that has to be done, so nobody is without obligation to sit with a benefit counselor, process the right paperwork, etc. I don't know that we need somebody, a hall monitor,
Okay.
If we take care of that on the front end. But if we don't take care of that on the front end, it'll be, yes, we'd need a hall monitor with a whistle and a lime green vest to try to keep people from leaving without, signing in and everything. So I think it's a smaller problem than we think, as long as we do it on the front end.
And also in those meetings, please tell them, especially if the Health Net form, that they can start getting all their forms filled out, so it will go quicker in the one-on-one meetings. Their benefit selection form for post-alarm. If they don't have medical insurance and they're not going to get medical insurance, they still have to fill out the Health Net form to decline it. So at least get the process started, and as soon as they sit down with you, I would ask them to pull out their paperwork and have it in front. As you're going through Harmony, they can be filling out that paperwork as well, so that it's not that you first do Harmony, then sit there and wait while they do paperwork. Try to do a lot of stuff simultaneously as you can. And I apologize for all the forms. We tried to get them just to do Harmony, but they did not want to give up their paper. And hopefully, with Stone Taper, seeing how well it goes, and because Patricia is going to get getting all the data for Health Net over to Patricia and for the AIG over to Patricia, and so hopefully once she sees how comprehensive the data is that we can capture, they will be amendable in future groups to not doing paper.
Yeah. So before we go to Andrew, when we get done here, I just want to do, a quick touch on what's coming. Okay, so we've got some key folks here on the phone today that are involved in, most of our enrollments. So all of you probably remember, I just want you to know about something that's working its way down the pike, and I'm hoping that everything goes in our favor. So I'm sure you all remember SGB&IA and the California Small Manufacturers Trust. It's been very good to us, and it's been very hard for us at the same time over the course of 2.5 years, 3 years. In the beginning, we wrote for SGB&IA about $1.3 million in 1 year. That was good for everybody. And then they started getting busy, and they felt like there was too much burden to have us help. And then in addition, we had some personality issues going on with the two girls inside the trust, and I'm just being candid. And they were bucking against us while I was trying to, promote us. And so that slowed it down too. So we kind of lost that battle. Since then, SGB has sold to Gallagher, which was a big deal for their owner. Obviously, he came out of that a pretty wealthy guy, as if he wasn't already. But Jim's a good guy, which opens up the Gallagher network to the California Small Manufacturers Trust plan. So what I'm in the middle of discussing right now with Gallagher is they called me, which was great because it wasn't that I pursued them, but I got a call from Jonathan Monroe, and they wanted to reignite the discussions about having Colonial serve as the enrollment team for the California Small Manufacturers Trust, or CSMT. And it's going to include not only the Woodland Hills office producers, but they're going to open up the trust plans so they can be sold by the Irvine office of Gallagher and 2 offices of Gallagher in San Diego. So you can kind of start to see how this is growing. They want to streamline things, streamline billing, streamline the benefits that are offered, etc. So we're way down the pike on this, and it looks good, but competitively, to be honest, what's happening is that the owner, Jim Scanlon, is looking at dollars because he's sold his company. He's got a 3-year buyout plan, and he needs to maximize the amount of income that he makes during that time, because it affects his payout at the end of 3 years because of the performance clauses in their contract. So we compete against some carriers who use enrollment companies, and they pay like 70% on some of their products first year. Then it goes to a pittance second year, but first year for policies is 70, whereas the way we pay is more like in the 20 to 25 range for your typical policy. Life can be up around 30, 35, et cetera. So that we're bucking against that. The internal guys, Nate and Jonathan, are pushing to use us because we're local, we're trained, we already know about it, we already have relationships with them. They know who we are, we know who they are, and all of that has big value because you can't put a price on headaches and everything else. Plus, we can help service accounts and stuff during the year. So just wanted you to know that this is coming down the pike, and it would mean a madhouse. It would mean a fourth quarter type of activity level in the months of into March, April, and May. Okay, because it is a common renewal of 6/1 for every employer in the group. Their hope is to get their renewal from their medical done early because it gives them more time to execute all of these enrollments. But if we all remember, I think it was the second year that we were going to do this. Andrea and I laid out this great plan. We scheduled everybody, scheduled every group, scheduled benefit counselors, and they didn't get their renewal for like 4 weeks into the plan.
No, it was almost 6 weeks.
Was it 6 weeks? Yeah, I knew it was too long, whatever it was, and it completely destroyed everything. We were having to turn benefit counselors away. They said, hang on, wait, we think it's coming tomorrow. Of course, tomorrow it wouldn't come, and we'd finally have to tell people there's not going to be an enrollment for that group, these groups. So all of those things are going to be addressed in these meetings that I'm having because Andrea, myself, we're going to, if this comes to us, we're going to have a second coordinator. If you guys have ever worked with Ronnie Warner, she's also a part of our office. So Andrea and Ronnie are going to work together because there literally could be 40 to 50 groups that we enroll in a 2-month period. So just wanted you guys to know, please don't plan vacations just yet during April and May because we're going to be, and then one of the things I'm going to do, final note, is we're going to have a half-day on-site, face-to-face training. Anybody and everybody who's involved as a benefit counselor or coordinator in the CSMT, we're going to do training. We're going to have all of their plans, broker representative, all of their forms. We're going to go through everything in intimate detail. So when we go to these groups, I mean, it's a cookie cut, and we'll all be good and set to go. But we have to get confirmation that it's going to be ours first. So if you pray or sacrifice chickens, whatever it is, please do it, and make sure that you point that energy in all of our directions so we can secure this piece of business. Yeah, buddy. It could mean $1 million plus in business. Yes.
Mike, so you're talking about this April and May?
Yes, ma'am.
All of this going, okay, gotcha.
So we could be very busy if things go right. All right, then that's it. I appreciate you all taking, I guess, an hour and 45 minutes this morning to spend with us, and we we'll hope that with all this prep that everything will go well on Thursday and Friday with the group, and we will check on Monday because Monday was going to be our follow-up date, and since it's President's Club, or no, President's Day. We'll check and see if they're open and get back to you about what day will be the follow-up day. And I'll send out, once I get the additional information or the corrections from Patricia, I'll update the guide and resend it out.
Cool.
Okay.
Thanks, everybody.
Thank you.
Thanks, Mike. Thanks, Andrea.
All right.
Thanks. Bye-bye.
Bye-bye.